Good morning, good afternoon, good evening. Welcome back to Passionate World Talk Radio. Educate, enlighten, entertain. PWTRN is a wholly owned subsidiary of Global Media Network, LLC. And on today's episode of Lest We Forget Historical with your host, Lillian Cauldwell, we will be discussing the mental health crisis in today's corporate America and mention that California is more directly dealing with the mental health crisis within their business, companies, and organizations. A little background. This is from Bing Chat AI. They say that the mental health crisis in California has become a high rising concern, both for individuals, the employees, independent contractors, people who work remotely or even within the office structure. And they want to explore and find out why this is so. So the first thing is you have to remember COVID-19 came in and left, but variants of COVID-19 still remain. The governor, Gavin Newsom, is leading a significant transformation of California's behavioral health care system. They have developed an expert panel which is discussing the origins of the state's broken mental health system and look to potential solutions. The Newsom administration is pushing ambitious policy changes to address these issues, or you can call them threats. As I discussed briefly, the pandemic exacerbated an already broken down and ill-equipped mental health system within California and the United States. A study by the Standard Insurance Company revealed that pre-pandemic, before COVID-19, 39% of the workforce suffered from mental health issues. Since the original pandemic of COVID-19, the number has increased to 46%. That's almost half the population, ladies and gentlemen. Businesses play a crucial role in the mental health of their employees, whether it's management or administration. And supporting it is for the well-being of the entire company, which also affects the U.S. economy and the economies of other countries worldwide. Lauren Cohan emphasizes the need to confront the invisible mental health crisis within organizations. And she has case studies that highlight the impact of mental illness on individuals. So what is a state to do? Well, I did some additional studies, and the California Business Journal has an article that was written by Naveen Bhattacharya, and she wrote it in the California Business Journal. And this is what she had to say. In March 2022 State of the Union address, the U.S. President, Joe Biden, declared that America is not doing enough to address what his administration calls the, quote, unprecedented mental health crisis, unquote. The president's comments made it clear that the mental well-being of Americans had really become a serious issue, and that if we didn't address it now, it would have far-reaching consequences of our mental health system in the future. Now, these are some of the stats they found. In 2021, the Standard Insurance Company revealed a study that showed how the COVID-19 pandemic had taken a bad mental health situation and made it progressively worse. 39% that in post-pandemic had mental health problems and suffered from mental health issues. Post-pandemic, it increased to 46%. That's almost half, ladies and gentlemen. Millennials look at it separately. The number of those reporting mental health issues increased to 59%. For Generation Z, it was an alarming 71%, 3/4. Deloitte's Women at Work 2022 study revealed that the changes brought by COVID had been really hard on women. Of those surveyed, almost half rated their mental health as poor/very poor, and 33% reported taking time off from work due to mental health challenges. You can't ignore these numbers. America is facing a mental health crisis that will only get worse if not addressed quickly and properly. For instance, in 2022, there was a flood of challenging social issues that workers in the U.S. faced. With the added stress from COVID-19 and social and political angst, that's additional stress that the work employees were experiencing, they also had to deal with rising inflation. Many remote workers are also suffering from loneliness and isolation. Think about it. You're used to going into an office, anywhere from 50 to 5,000 people. I can see where you would find yourself isolated and alone. My grandson told me his teacher provided every one of her 30 students a tablet, and every Thursday at 2 o'clock, mandatory. They all used a link. They all went into a conference room. They all got together and they talked and chatted with the teacher and amongst themselves to try to get rid of some of the isolation and the loneliness these kids face because they no longer had the other 29 or 30 classmates with them, talking to them daily. As companies look to revise their return to work policies, and where only the COVID has subsided, there are some workers that are still left scrambling to adjust their living situations with regard to home health and, yes, daycare needs. My kid came to work with me plenty of times because the daycare was inadequate. I couldn't afford to pay for that month. Bad weather prevented it from opening, or it was closed. So I had to take the child in with me, and he would sit behind my desk, drawing or reading a book, out of sight, out of mind, quiet. From a financial perspective, the numbers are just as bad. The Standard Insurance Company survey found that during that pandemic, mental health issues were causing 65% of employees to lose 10 or more hours of productivity per week. The World Health Organization determined that depression and anxiety issues alone cost the global economy an estimated $1 trillion each year. Think about that. The American Psychological Association recently described our mental health as, quote, sustained survival mode, unquote. The good news is that businesses are starting to increase the amount of attention that they're giving to the mental health issue. However, it's not really receiving enough for the attention it really needs to succeed. According to a 2022 joint study by the Society for Human Resource Management and Asuka Pharmaceutical Company, only 32% HR professionals say offering mental health resources to their company's employers is a, quote, high priority, unquote. The study went on to reveal a number of stumbling blocks that are keeping businesses from elevating efforts to help employees in the mental health arena. It showed that 33% of businesses simply haven't thought about workplace mental health, and that 27% were unsure of which benefits to provide. In addition, a survey found that 21% said providing help was too expensive. Have we heard that before? Although these survey findings are discouraging, there is some action that is being taken, and it did show that HR professionals believe doing more would recap and reap benefits for their organization. 88% said it could boost productivity. 86% said it could increase employee retention, and 72% said it attracts new talent. More than half of the workers surveyed agreed that providing mental health resources is an attractive benefit, and they said outright that they would leave their current job for one with significantly better mental health benefits. So where does this leave corporate leadership? Corporate leadership said for the sake and health of their employees and their bottom line, that they must take steps to establish and maintain programs that promote mental health in the workplace. In some organizations, they start by making the issue more of a priority, with C-suite executives taking the lead and destigmatizing the topic of mental health and acknowledge the role it plays in the success of their business. Now, I had a cousin who needed mental health help, but he refused to get it because he said it would jeopardize his job and would decrease his chances of obtaining a new one. Think about that. According to a survey done by McKinsey, 65% of employers said they would support mental health well or very well. Only 51% of employees agreed with that. One way to fix the disconnect is to survey employees to find out what they would be most helpful to them. And armed with their employee feedback, employers may find it necessary to reassess policy, looking specifically at a paid time off, in-office or online resources, and the internal communication strategies that are used to address relevant issues. Our mental health, it underpins every aspect of employee well-being, productivity, and retention. Traditionally, we've seen a lack of access to quality professionals, which created structural barriers to achieving mental health parity, especially for people of color and LGBTQ+ communities. While some mental health is offered, it has fallen short. A solution like NeoMind, MEOMIND, the world's first therapy platform, can help to reduce employee turnover and burnout, increase employee productivity, and lower healthcare costs. NeoMind is able to fill in the gap by providing 24/7 access to pre-recorded sessions between therapists and clients, and further support employees with the events, mental health scores, journaling, coaching, exercises, and diversity focus. Addressing this mental health crisis may also require embracing holistic well-being strategies by extending healthcare benefits to cover them. These benefits can include acupuncture, massage, meditation, yoga, brain spotting, transcranial magnetic stimulation, biofeedback, and more. Individuals exploring mental wellness supplements like Noobru, Noobru, Insights for Authentic Noobru, Noobru reviews to inform their holistic approach to mental health. And two, we as a nation address the mental health within our business organizations, like California is doing. We are not going to be able to prevent our employees from becoming depressed, anxiety-ridden, and inoculations for viruses. There are some diseases that also induce depression, like lupus, systemic lupus, for example, an autoimmune disease. You don't think that can happen, but it can. If you have cancer, if you get diabetes and you can't afford your medication, your anxiety for not obtaining it, that is a mental health issue. Avoiding the next great health crisis requires that corporations acknowledge the dangers presented by ignoring mental health in the workplace and the steps to prioritize it with appropriate solution. Naveen Bhatia, Bhateja, an EVP and Chief People Officer at Metadata Solutions, leads all aspects of the company's global human resources. As a member of the company's senior leadership team, he is a business strategist and trusted advisor on how people strategies empower successful business outcomes. I want to thank you for listening to this episode of Mental Health Illnesses in Corporate America and California. You can listen to this all over again on YouTube, _PWR Network, Talk Radio, pwtalkradio.com. Also at passionateworldtalkradio.com. Look at the blog. Number 2, there's a new book out. It's been revamped, written by Vicki Esther Chang and Lillian Cauldwell. Gold Nuggets, digital strategies for podcasting. It's over at Amazon.com. Look it up under Vicki Esther Chang, Chang. Are you interested in becoming a podcast or a program host? Then come check out PassionateWorldTalkRadio.com and see what you can do as a host on our station. We are heard in over 172 countries, and since our beginning, we have had over 10 million listeners to our station. Text us at 484-364-1032 or go to the website. There is an answer phone. Put your name, put your email, put your phone number. Best time to call and let us know that you're interested in becoming a host on Passionate World Talk Radio. Again, thank you very much for listening. And remember, please keep listening. Thank you.